Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Zoe Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Activations is something that I increasingly use to prepare horses to work and to aid in altering movement patterns post a bodywork session. I've seen significant changes in the way that horses are able to move when they truly activate the correct muscles for self-carriage. But to get the most out of an activation, you need to really observe which muscles are actually active and is the horse bracing against you or truly loading the desired area. So you need to know the difference between a healthy activation and bracing.
Yes, and I personally have experienced this myself in a workout program that has been developed by somebody who has a PhD in glute muscle activation and development, which, yes, I think his program is quite funnily called Booty by Brett, but it is a whole body program and it's very well based on scientific principles. So he gives activations before his workouts. So these have a really strong focus on form combined with slow and controlled movement, and we're highlighting awareness in the body. So he really talks about awareness that you have in your own body. So he encourages before working out, whether you're doing glute activations, core activations, it might look like stacking your ribs over your pelvis and engaging your core. And then you would make sure that your shoulders are nice and even and set back rather than being crouched over. Sometimes he'll ask you to put your hands against the wall if you're having a hard time with rounding over. And then he'll say, okay, engage your glute muscles a little bit and make sure that your femur, so your hip doesn't externally rotate and your knees don't turn out. But then you begin to further squeeze your glute and you squeeze your glute so hard for 30 seconds and then you release. And then you would wait a minute and then you would repeat that exercise maybe 3 times before you even go and do your workout, like if you're doing hip thrusting, so you're lifting weight using your hips, or you're doing other work that's meant to be glute focused. And there are other activations for different things. So if you're using your upper body, he would, even if you are somebody very seasoned with being able to do a lot of push-ups, your exercise before you work out is to do slow and controlled push-ups against the wall in a way that primes the muscle and activates them. So this makes a really big difference for muscle health. And also on days between workouts, he will also get people to do these muscle activations and encourage people to use good form in day-to-day tasks so that it becomes part of the way that they move in general.
Yeah, I mean, it's interesting because there's conscious awareness of the way you're sitting and moving and utilizing the brain in that motion. But then there's what your body wants to do. And if you keep, because I'm studying at the moment the somatic movement exercises, and it talks about, if we just keep correcting it, that we're often not changing the movement, the motor pattern specifically, and that to change the motor pattern, you need to become very aware of, say when you're talking about your glutes activating, well, I was just doing that while you were talking, and mine, both sides do not feel the same. So they both will switch on now, whereas they used to not, but they don't feel the same. And so I can contract both of them, right, for 30 seconds, but it feels different. And so that's something where if you become aware of that, then you can take it to another level and, maybe then you need to separate the sides and do one over, one side and then the other side, or figure out what your body wants to do to then create a new pattern. And the thing that I'm learning is that we can correct our posture 15 million times a day, right? Like shoulders back. How many times has your mum said shoulders back, head up, don't put your neck forward, blah, blah, blah. But if you're having to correct that all the time, then you have not changed your motor pathways, because when you truly change them, it doesn't require you to correct it anymore because it's become a new pattern of recognition in your body. But to get it to that place, you want to bring it into a conscious place, which is why we talk about the really slow and controlled movements in horses. So with horses, like what I've noticed is that we have to be more observant of when they're bracing versus when the muscles are actually activating, and also their conscious awareness and presence within their body when that's actually happening, because they can also go in automatic and we can say, hey, lift up your shoulder, and they do it, but there's no conscious connection there, like they're just going through the motion. So the aim with the muscle activations in horses is that you could get to a point at which they can do it correctly, which is kind of what you're saying with the 30 seconds by 3 in humans. But most humans could not start with 30 seconds times 3, contracting both glutes evenly. They might have to start with like 2 seconds and separate the glutes and, kind of make sure they've got pelvic function and other aspects there. And so in the horses, you want to get to a point where you could keep asking them for activations. They could do as many as you can do until you get bored. Because every stride that they take out there, like how many strides does a horse do in a training session? How many strides does a horse do in a day when they're doing dressage, show jumping and cross country, over 1 or 2 days? Like what we want is that every stride is optimizing which muscles are actually working to prevent fatigue and to prevent overloading of the joints and overloading of the tendons, which is commonly what we end up with in horses. So when your horse is doing these activations correctly, and it doesn't mean you go out and do 50, it means that you want to know the quality of those activations, because when they're doing them correctly, you should be able to do them till you're bored. Do you know what I mean? Like however many sets, however many reps, the horse can keep doing them because they are activating the correct muscles every single time. And then we know that when they're going out there and they're actually working, we're not always getting fatigue and a lack of support to those joints.
So when it comes to what an activation does, activations are for priming and engaging a muscle or group of muscles to create a neuromuscular connection and to warm up the muscle. So the use of a muscle includes the nervous system, and we can move the body in a way that challenges a group of muscles in a more isolated and concentrated way. And this encourages the nervous system to prime the muscles, aka get them ready for work or movement, or just whatever that horse needs to do in their day-to-day life, wherever they're at. So as we use this activation, part of that is you get a faster nerve transmission, and this will increase your coordination, motor control, reaction time. And it's important to recognize that we're discussing activations from the perspective of improving coordination, motor control, and reaction time. So we're not talking about strengthening. Often, yes, we do see an increase in muscle size of the small spinal stabilizers. They've shown that, they can ultrasound those and see that they're increasing over time as postural work is being done. But the aim that we're looking for is better motor control, better neuromuscular connection, better ability to control your body. So we're priming the muscles as well by increasing blood flow. Fascia and other tissue warms up. It becomes more pliable. But yeah, the whole idea is the healthy individuals stabilize and support first, and then they move second. And so actually, this is a really big part of the equine functional posture course, where in level 1, we go through assessing posture and then beginning to increase some stability exercises during feeding positions, because one perspective here is that the best horse bodies are challenged in many ways that use important groups of muscles. And you've seen that, and we've talked about that in the podcast, from horses with fantastic bodies living in the right kind of wild environment. And our domestic environment doesn't offer the same challenges. And we're trying to work to introduce as much positive input to influence the body well. So in the course, we begin to introduce a few exercises, and then we move into, okay, how can you improve your stability and support, and then initiate movement from that position in a slow and controlled way so that you are building a motor pathway, so a movement pathway that is really healthy, and that you're activating the right muscles as you introduce movement. So pain and dysfunction alter stabilization, timing, and recruitment order. So when we have horses who've had injuries, they've had chronic postural issues, they've become stiff or uncomfortable, whether it's, like we say, from injury, from age, from the way they've been moving, this changes how their body stabilizes and which muscles they choose to recruit when they do certain movements. So if you have a horse that doesn't have very good postural muscles, thoracic sling, spinal stabilizers, their core has become dysfunctional, they're often using other muscles to stabilize, and that includes brace most of the time, because they're not designed to be controlling your horse's small postural movement. And so often when we begin to introduce activations, they can fatigue easily because that dysfunction has changed the way that your horse is moving the muscles that we're trying to target with activations. So we just want to describe the equinology description of a specific activation, which is a caudal tail shift, and with a couple of additions from Raquel. But this is a really valuable exercise, and it's an example of an activation. So in this particular one, you would be standing behind the horse if it's safe. So you want to make sure that they're comfortable with their tail being held and moved. In this exercise, we're going to be going through a system of pulling on the tail. You want to hold their tail gently. When you place your hands, you're going to put them at the end of the tailbone and supporting the tailbones well. We want to be then pulling on the tail hair connection to the dock, and you're going to take up a slight traction, making sure that your tail is still in line with the sacrum, and you want to increase the force until the activation is noticed in the top of the hind quarter muscles. So you may also get someone at the front to look at the pectoral. So this is, you might have somebody holding the horse at the front. So you're going to be looking over the top of the horse's hindquarters, and somebody might be at the front, and where they can look is at the pectorals. So that's the chest muscles. And what you want to do is you want to hold on for maybe a second or two. So what you'll see is a little muscle activation, a movement in those muscle groups. And you want to make sure that the horse isn't bracing against you or moving away, so that they're not stepping sideways and they're not trying to immediately offload a leg, but also that they're not groaning or pulling against you. So then you want to release that pressure slowly by 50%. So you're not dropping them quickly and you're not taking all of the pressure off, but about 50%, and then you're going to repeat. So this exercise you would start with 5 to 10 repetitions, so doing it 5 to 10 times, and then you would do 3 sets. So you want to also increase by 10 each week. So on the second week, you would do 10 to 20 times 3, And the next week you would increase by 10 again. And you want to work up until your horse can do 5 sets of 10 or 3 sets of 20. And so when you're doing those, we're still looking for quality. So you still don't want your horse to be racing, moving away, stepping to the side, or trying to get away. When you begin this exercise, you may not get a horse that stands square, especially if your horse has some dysfunction, pain, or you're working with a rehab practitioner, a vet, or a body worker. But we want to make accommodations for the horse in front of us. So initially, your horse might stand how they want, but we're working over time and aiming towards them being square while you do these exercises. And that's because when a horse is in a 4-point balance, you're going to have a better, even and symmetrical muscle recruitment on each side. So yeah, that's an example of the way that you would do an activation that is effective and isn't too much for your horse and isn't asking them to brace rather than activate.
Yeah, and then it's kind of there's lots of ways that you can actually apply activations, and so the most common talked about ones are the caudal tail shift and the lateral tail pull or activation. But you can apply a lot of exercises in the form of an activation. And I'm often trying to figure out, I'll be treating a horse, released a problem area, and I'm like, okay, how can I get that to switch on? And sometimes I'm experimenting until I, get that horse to switch on that area. So as you become, more experienced practitioner, then you can experiment with, become more specific about which muscles you want to switch on, how you want them to switch on, and then I take it into movement as well. So, I've played around a lot, especially with Jelly and Ellie. And with a caudal tail shift, for example, I couldn't do it on Ellie for quite some time because she was too much discomfort in her hind end and her tail would clamp. And so you do not want to do it if there's any obvious signs of pain or discomfort. You don't want to do an activation if there's any of the activations if there's signs of pain or discomfort, because then you're just creating brace and they'll probably just bring in the big guns, the big muscles to help support themselves, or they'll do whatever they need to do to, give you the response that you're doing. So you want to make sure that they're as comfortable and functional as possible. And obviously a good body worker will be able to test that function. You also, with Ellie, she wasn't comfortable in the tail. And then when she did get to a point where she was able to start doing tail activations, my level of pull was really small. It was so tiny. It was trying to think of an example, but it was, I can't think of an example right now, but it was a very small amount of pull, and I definitely wasn't using my whole body weight. And so you do want to make sure that when you're doing them that you have really good support through your body and that you're not bracing and that you're not using the horse to support yourself. So if the horse moves, you're stable and you're safe. And so then I've probably been doing them with Ellie now for about 6 weeks since I said that she could do them well.
Yeah, thereabouts, probably the start of the last.
Yeah, so probably about, the 6 weeks, maybe a little bit longer. And there was just a point at which I was like, oh, she can do them now. She wasn't moving away. Her tail was comfortable. And both of her glutes had that, what Sophie said, that, I describe it as like a little filling that I see on top of the glutes. It's like they fill up a little bit, they bounce up a little bit. And what I'm looking for is that it's happening evenly and at the same time on both sides of the glutes. That's the easiest place to see it because most of the time you can't visualize the abdominals and it's hard to visualize the gracilis or the pecs. But if you have other people with you, you can ask them, like Soph said, what's happening in the pecs? And sometimes I will say to my owners, what's happening in the pecs? And they'll be like, one side is contracting and working, but the other side is not, or they're doing it at 2 different times. And I'm like, okay, so then I will often change something, like I'll let them go, give them a rest. That's really important between your reps, is that you do your reps and then you take your hands completely off and you allow them a minimum of 3 breaths at least, until they kind of relax and the body seems to just go back into neutral. Because then it gives those like nerves and muscles that option just to fully relax. And I find then the next time that you activate, it's a brand new input, and often you'll get a different response, especially if they're a bit uneven to begin with. Sometimes I'll also slightly change my position. If I feel like one side is more than the other, I'll just slightly move to the side that's not looking as active and just see whether. And then the other thing to do is, if you're not getting a nice filling up, then I tap the muscles. And so it's basically saying like, hello. It's giving input back to the nervous system. It's giving also to the brain. It's saying like, you have these muscles here. Would you like to switch them on? And I'll tap them or scratch them, rub them, stop, take my hands completely off, maybe do that again, stop, take my hands completely off, and then do the activation again. So it's changing the input into those muscles so that the nervous system and the brain goes, oh, yeah, oh, I forgot about that muscle. And the other aspect of it too is if say the glutes are super tight, you're not going to get a good activation. You don't want to activate a tight muscle. So if I feel the glutes and they're like really tight, I'll do some gentle, or the back, do some gentle massage, increase the circulation, relax that area, give it a moment, then maybe tap it to say, hey, can you switch on? And then switch it on. So we're not looking for brace in the muscle. We're looking for the nervous system control of the muscle, which is what Soph talked about before with the stabilizing and supporting first and then moving second. So that's basically what we're doing, is we're preparing the muscles to then go on and do a workload, but making sure that we've got an even motion happening there. So like the caudal tail shift is one that I use a lot, and I have a lot of clients doing it, but the one thing I want to make sure is that the horse is not pulling forwards. And so if it feels like the horse is pulling against you, like I think of it like the horse is doing a squat. And so when the horse is doing a squat, they're kind of like coming back towards you when you ask for the activation. So the glutes are activating because you're transferring the weight back to the hind end. But what can happen if horses are uncomfortable or there's some maybe pelvic discomfort, they'll pull against you. And so if it feels like the horse is pulling against you, then there's probably a reason for that. And if you look from the side, like if you take a picture or a video and you look from the side and you see them really leaning over their front legs, then you're not getting a true effect of that tail activation. You're actually then getting more of a tail traction or lengthening, which we talked about in another episode where we talked about the difference between mobilizations, lengthenings, and activations. So, and then it's the same with the lateral tail shift. So doing it from the side, the way that it's been described is that you stand directly from the side and you pull the same position that you have for the caudal one. You have the tail, you have the end of the dock. I have also done it from the top, but I find some horses are a bit uncomfortable. They don't like the pull that creates through the tail connection to the sacrum. So probably over time I've gone more lower, and you're pulling them to the side to get them to wait onto the leg closest to you. And what I'm looking for is, do their quads. So people talk about looking at the tensor fascia latae, which is the stringy muscle, but I want you to look at the quads. So can you see a filling under that TFL? And because they're the muscles that are going to really support the stifle, the TFL is very fascial. It is important for motion, but it doesn't have a big muscular component. The quads have the big muscular component. And the quads attach to the patella, the kneecap, and they're the ones that are going to support alignment of the stifle, not the TFL. TFL is not going to support alignment of the stifle that much. So, and what I found is that a lot of times, if you just pull to the side, you can get an internal rotation of the stifle, and that we don't want that. That's going to increase strain and tension and pressure through the stifle. And we see a lot of horses that have twisting through their hind limbs when they move, and this is where good activation becomes really useful because it will help stop that twisting. If you've got your glutes working properly, your quads working properly, your biceps, your gracilis all working properly, you're going to reduce the twist. And so when I ask for the lateral, if they pull away from me and they brace, I will actually ask them for the leg closest to me to stand just a little bit back, just a little bit behind the other leg. And then I actually pull on a slight angle. It's probably about 30 degrees. So I'll bring the tail like on a slight angle. And what I've found is that gives me the best quad activation. And then you're working towards a place where the horse can go square. And I still go on a slight angle. I've still found the angle to be better than coming just straight across, because most horses, when they come straight across, they'll often pull against you. So as they build up, like this might be months, you can pull them straight across and, they'll be able to switch from side to side. You'll see beautiful activation of their quads. But initially, when you're really looking for that quality, have the leg slightly back and have it on a slight angle and really look under the TFL. And again, give them a break, tap that area, scratch that area, take your hands completely off, do it again. Now, when Sophie said start with 5 to 10 reps times 3, sometimes when I first begin, I'm doing it until I get activation. And so initially, I don't really count, but initially sometimes it could be I do it, 3 times 10. I don't know. But I do it until I get activation. If that took a long time, then at that point I might ask for just a couple, like 2 reps, stop, 2 reps, stop, and then stop. So the longer that it took, I don't ask them to keep activating. But what I want to see is the next time I do it, it activates quicker. So it doesn't take, and this is where we can get caught up doing things by reps and sets, is that you're looking for correct, you're looking to get what you want out of the exercise. So as you build it up, you will go to reps and sets. But when you first start it, you've got to do it until it activates correctly. And then once it activates correctly, then tomorrow what should happen is it activates correctly quicker. And then the next day quicker, and then quicker and quicker and quicker, until by the second or third rep, it's activating. And then you get to a point by the first rep, it's activating. Then you can go, okay, I'm going to do 5 to 10 reps of this now. But yeah, if it takes a long time, don't do too much, because what I've found is when the muscle is first switching on, it fatigues really fast. So it often can only do 2 or 3 reps. And then if you keep going, it just starts bracing because it's like, oh, that was so hard. So just be mindful of that. And that's where, it's good to be done by a professional initially, but I still think there's not many professionals who can do it well, because it's something that I have, I learned my activations to do them well through equinology. I think they do it the best from what I've seen. But then I've just become more and more aware of what I'm seeing in the horse's body. And so, I've kind of learnt through my anatomy knowledge, to apply that, and then through my biomechanics knowledge to see, okay, well, does the horse actually move different now? Is that joint stabilizing differently when I ask for the activation? And we've got to continue to ask questions. Don't just do the exercises blindly. Ask questions and say, okay, what's happening with my horse now? How are they doing them today compared to yesterday? And what I'll notice things like Ellie puts her head down. And I know when she's putting her head down that she's trying to offload the hind end. So I want her to get to a point at which she can keep her head in neutral. If they step off, I'm like, okay, why did they step off? Maybe I could ask less. I don't want them to step off. I don't want them to put their head down. Did they shift their position? Shift their hind limbs? Then I'm like, okay, could I ask less? Could I change my position? Why did they step off? Is there still too much dysfunction there for this exercise to be applied yet? Could I change the order of how we're doing things to see whether I could, if I did this one first, does it help? So for example, if I did the lateral ones first, does it help the caudal ones? Or for this horse, does it work better to do the caudal than the lateral? So we're always thinking about our application of exercises, and we're always thinking about the individual horse on the day. And that's where, especially when we go into level 2 of the equine functional posture course, we really start to hone in on, we don't teach activations until level 2 because they require skill, awareness, palpation, and they also require the horses to be in a suitable functional place to be able to handle an activation. So, yeah, would you, Soph, like to talk about, you talked about changing the order for a horse when we were having a discussion before and how doing one before the other helped?
Yeah, so I have one horse that I still see very regularly, Cisco. He has had big belly for a long time. And so he also had a very dropped thoracic sling, and he had a lot of trouble engaging through his hindquarters. And he was having a lot of trouble with a belly lift for a long time. And we had to get a little bit creative and say, okay, how can we make it easier for you by setting you up so that the rest of your system is already supporting part of the belly lift process, because a belly lift is a belly lift, but it also incorporates other parts of the body. So we started doing it's called a lateral pelvic rounding, but what it does is it basically asks the horse to enter a bend and a slight flexion with their pelvis. And so you'll see an activation of one side of the horse's core. So you see the belly shift up on one side, and then on one side they've basically become like a bit of a banana, but also rounding through their back a little bit. And so in doing those activations on each side, it's been enough that his abdominal function has improved without being as difficult for him as a belly lift, at the same time as he's continued to do his spinal mobilizations, and his owner is fantastic and very consistent. And now a belly lift is getting easier for him. When I come and visit and I go for an assessment in the beginning, he can nearly always, unless she's had to take a small break, he can nearly always give me a decent quality belly lift. And that's had a really big impact on him and his willingness to go forward and come back into work. So sometimes being creative for the horse in front of you is necessary. And so, like you were saying, the ability to observe which muscles are active and understanding what your aim is and also your anatomy means that you can help the horse get back to being able to do something by introducing something first, a little more like it's a bridge to get to where you want to go. And so that, again, being able to help the horse activate the correct muscles. Do you need to shift your position or their position slightly? And being able to understand that when things are difficult, that rest between the activations and returning to neutral well. We actually discussed that last night in a Q&A, the fact that rest when things are difficult, and we just did our episode on brain breaks as well, that talked a little bit about having a rest for fatigue in the body as well. But when you allow a really good rest between activations, it gets better each time. Even when, like you said, in the beginning, you're not doing as many of them because the muscles are fatiguing quickly, they will improve dramatically when you don't overdo it. So, yeah, these examples, I can think of a few actually now that I'm thinking about them, where you've had better results because you didn't continue to force an exercise. You've either done less of it, of the exercise, you've done less within the exercise, so you're asking for less, only a tiny activation, or you're trying to think of what else could I do to bring you more function in an area so that we can edge into asking for that in the future.
Yeah, it's like, I think like working with Ellie has really shown me a lot, because she struggled a lot with her trot, and so because of her pelvic injuries, and she also had like shoulder tension as well, and she could go into a head position where her head and neck looked quite nice and neutral, but her back was dropping and her belly wasn't engaged and her pelvis was disengaging. And I was thinking, like, how do I change this? And the pivotal thing for me was getting function and activation before asking for the trot. So I played with this by asking for trot and observing, okay, that's where her trot's at today. Then I would stop. I'd do, within my activation, I would do belly lift as an activation, not as a lengthening exercise. So where I'm like, okay, lift your belly as much as you can and as much as you're comfortable. Take my hands off, 3 breaths at least, let her go back to neutral. Lift it as much as you can, activate it, take it back. And if she was biting me, kicking me, moving away, then I had to address the reason for that, not just keep doing the belly lift. Then I would go to the pelvis and I'd do pelvic extension in the same way, pelvic rounding in the same way. So like both allowing space in between, and also making sure, like looking at how did her back activate when I asked for pelvic extension? Was it even on both sides? Did I see the longissimus, contract and ripple all the way to her wither, or was it just brace in her lumbar? And that was a pivotal moment for me, actually. I remember talking to you about it and saying, oh my God, today I saw contraction. It wasn't just a bracing when I did the pelvic extension. It was like a ripple along her longissimus, both sides evenly. And when I first started doing it, it was different on both sides and there was much more brace. And so I do the extension and then I do the flexion, looking for like activation of her biceps, quads if I could see, the abdominals if I could see them. And I'd alternate between them, and then also the base of the neck in the longus colli. Now, this is a very specific area, and the more aware I've become of this, the more I can feel a horse, whether their longus colli is symmetrical, activating, or switched off. For me, Ellie's was switched off and her right side feels weaker. And also when you touch a muscle, the muscle should kind of, hello, like it should respond to your touch, especially if you give it a little pinch. Then the muscle should be like, because the nerve should recognize, oh, that's a bit weird. And so what would happen with Ellie when I'd touch the base of her neck is nothing. Nothing would happen. No response. And then I noticed with Jelly, who I've been doing it with for longer, that when I touched there, his both sides contracted. And he went into flexion himself. His head and neck went into flexion because he lifted, the longus colli went up and lifted the base of his neck. And so I still feel like Ellie's right side is less, but now when I go to touch there, she goes, oh, and it's not a trained response. We do not want it to be a trained response. We want it to be a neuromuscular response. that the muscle says, oh, you pinched me. Like, oh, what was that? Not that she's just flexing her head and neck for the sake of flexing her head and neck. And so what I want to see is that the activation of the longus colli, the belly lift, which is the abdominals, the pelvic extension and flexion, which is your back muscles and your pelvic muscles, that they all come together. They're all comfortable, functional, and the right muscles are switching on. When I can get that connection, then the stability through the back improves. And then her trot, so her downward movement of her back has become way more stable. So there's still some limb stuff that needs to be sorted out, but the back has become more stable. Now, I did this in a clinic recently with a horse, a few of them. There was one that's been diagnosed with kissing spine, then there was the old horse with the sinky back. And the old horse with the sinky back, he was quite externally aware of the environment, and he wasn't really internally present. And so the young girl, she was 13, and I showed her, okay, this is what we're doing. This is what we're looking for. And then we also helped him learn a new movement pattern going from walk to trot. So we did the activations first, and then we showed him how to hold himself in it. So I actually trotted beside him until he could find that pattern. And as soon as he found it, I just let him go, basically, yes, that's it. And I also showed her how to do it in her body. It was amazing. And by the end of the session, he was present. He started investigating in the arena. I think we talked about it with the brain breaks last week as well. And the week before, a few weeks before. But he became connected to his body and his environment. So I got a message from her the other day, and her mum, and she said that her daughter says activations are the bomb. And she went out, won her pony club competition. And yeah, I'd love to see her little horse again. I think she's going to do level 1, which will be really cool. But activations are the bomb. They are the best exercises that I have ever come across when done correctly and when applied functionally, and when we are observant of how the body and the nervous system is connecting to the muscle activation. If you just do it blindly and you're just doing reps and sets, yeah, you'll get some benefits, but often you'll end up with more brace, and the horse will compensate. Learn how to do it with feel, awareness, connection. Ask what you're doing, why you're doing it, what's your purpose, how are you going to progress it, and really ask yourself, is this making a difference to the way my horse moves? Because it should. And if it's not, then you need to maybe go back and have a look, because every client that I've had where they've started doing activations, they're like, oh my God, I've noticed such a difference in how quickly my horse can start working. How that thing I was struggling with has improved. I don't tell them, look at these things. They come back and tell me how those things have improved. So yeah, when you get activations right, there should be a continual improvement in your horse's stability, strength, stamina, connection within their body, connection to you, connection to their environment. It is a game changer when they're done well. So,
and horses at all stages can use them. I mean,
100%.
we've had a number of episodes on different styles of, rehab for tendon injuries. We've talked about rehab in our most recent episode, as we record this, about rehab conversations, and that walking is not rehab. If you think about how to incorporate muscle activations, whether you're exercising or not, whether you're going to continue with a workout, whether you're going to continue with a ride, you can do these regularly, even when you're not exercising, because they are valuable for keeping your body in a motor pattern, so a movement pattern that continues until you either resume work or even if you never resume work again. You know,
I have
older people
retired
might
horses doing these. Horses that are not
exactly,
in
and
work, not ridden, and the difference in their posture and like their, you know, the just even in how often I need to treat them has
yeah,
decreased.
it makes a huge difference. And like you were saying, it's always aim based. So for the horse in front of you, what are we aiming for? But I used the example before as a warm up before you're about to do strength training. So before work is an option. You can do them on the days in between to make sure that the same muscles are still getting a little pump, a little blood flow,
Like,
which
hello.
Yep, keep working, keep turning on. For me, myself, I've talked about Charlie before. He had a tricep injury 18 months ago now, but tricep activations are a massive part of absolutely every single session we do. If I'm feeding him, I'm doing a couple of activations. If I'm trimming his feet beforehand, I'm doing some tricep activations. When we go and go for a walk, we do some tricep activations because that for him is something that is a continual something that it's one of his limiting factors. And now for him, I can prime it and feel the difference within 20 to 30 seconds of the muscle filling and becoming more active, and his elbow stability improving, which can get a little bit clunky now. So all of these exercises make a big difference wherever your horse is at. And we've talked about horses on stall rest and continuing with these exercises to keep their core activation and their spinal health and their spinal mobility. And we've talked about it for horses who are increasing workload but aren't using their glutes and quads. And so you need to bring them online before you go and do stuff, because the way that you do the exercise determines the value of the exercise to your horse and your goals. And to you as well.
And also, it doesn't just have to be at the start of a session. So, one thing I'll do with Ellie is I might do them right at the start, and Jelly, I might do them right at the start. But then if there's something I know that they have difficulty with, like it's maybe a new exercise, or say I've done a heap of walk stuff with Ellie and now I'm going to trot, or I've done some stuff but now I'm going to do some poles, you can do them during your session. It's obviously easier to do on the ground, but so because especially when muscles are just starting to come back online and you're just getting them working again, like during a session they can get tired, and so they can go, I'll just let the big muscles do the work now. So you can stop, give your horse a rest, do some activations in the middle of your session. And also it's a good checking point because you can go, oh yeah, that was easier than before. Actually, no, now they don't want to do that, then you have to look at what you were doing. But yeah, it's a really good checkpoint, and it's a really good reminder to the muscles. Remember, you need to work. And then I will also do things like ask them, like with Ellie, sometimes I'll do a more active activation where she's doing it, where I'll ask her to pick up her legs and hold them up and put them down in a really slow and controlled manner. That's a different form of activation where I'm actively asking her to do something in a really specific, slow, controlled manner. It's not, I'm not training her to pick up her legs, if that makes sense. Like, I want her to do it with awareness, not just do it because it's a trick. I want her to think about the quality of that movement, how slow she can do it. I also want her to be able to hold it up for longer if I say, can you hold it up for longer? But I don't want her to hold it up for longer if her back starts to dip. So I'm always looking at, how she's coping with that. But there's so many ways like that we can apply activations, and we just have to become a bit inventive. But the caudal tail shift and the lateral tail pull, the belly lift, the pelvic rounding, pelvic extension, and the base of the neck lift. Like, they're just a few really good examples that you can kind of start to think about. But don't forget, all of those exercises can also be done in a completely different way. You can do a belly lift in a beautiful lengthening, relaxing, opening way. You can do a tail traction lengthening, where it's all about lengthening the spine, lengthening those connections. So, just because you see someone in a certain position does not mean that they're doing an activation, or you don't know what exercise they're doing. It's in the application of that exercise as to how they're doing it, and also in their awareness and intention of the horse. So yeah, I just encourage you to be more aware, more observant, ask why you're doing something, how you're doing it, and are you getting improvement.
Can I just add as a final comment? Before this episode, we once again checked the research again. You've already done a lot of work and research and carried out research in this area, but in studies, there isn't a very clear demarcation or explanation in horses, published studies in horses about the execution of an activation. And when you're looking at those studies, if you're listening to somebody who's explaining those studies about activations or making comments about the studies or what they've seen, it's important to understand that in those studies there isn't a definitive. So as an example, in one study, they'll do a tail traction and hold it for a number of seconds, and they're describing, because you can measure this, activation in different areas. And so it's important to recognize that you can do the exercise in a specific way that doesn't replicate the results of what they're getting there. And so that's why it depends on the individual horse in front of you, rather than applying a blanket exercise to every horse, because horses respond differently to the same exercise based on the body that they have on that day. So it'll be exciting to see where studies go and what things we see, because there is more demand, more awareness, more research happening, which is just fantastic. But at the moment, it's important to know that execution and application is still the most valuable part of an exercise, regardless of what the exercise is.
Yeah, definitely.
And having the professional insight and development of your own observation and understanding of your horse and their body to be able to use exercises for their benefit.
Yeah, definitely. The more you can know your horse, the more observant you can be, and the more you understand what your intention is, then the more you're going to get out of an exercise. And also just recognizing the signs of your horse's, restrictions, fatigue, all of that information is just extremely valuable. And yeah, I use activations every day before work, and it tells me where my horse is on that day. It tells me, oh, yep, they're in a great place today, and yep, usually if they feel great, they go well. But if something is off, one of the glutes doesn't activate properly, they step forward, they twist their neck, they lower their head, they raise their head, they twist to one side. Any of that is such valuable information for me to go, all right, something's not right here. What can I do? Can I do something to change this? I'm lucky, I have skills that usually I can then figure it out. Do I need to stop? Or can I try something else to see whether it improves this? Maybe I'll just move them a little bit, see what happens. But if it continues to show up as in their key activations, if I continue to get a problem in there, then I'm like, okay, like there's no point working my horse today, because they're not going to be like working well through their body. And so I need to figure this out before I even bother, because I've done trial and error and, I've gone, oh, well, that's not ideal, but we'll just still do the work. And I'm like, oh, well, that doesn't look very good, does it? So yeah, it's really correlated. Good activations, whole body activation equals good work, quality work. And then, like Soph said, you then get appropriate strengthening, reduction into fatigue times, and improvement in injury prevention, and improvement in any horse when done well, regardless of age, workload, problems. It's tailoring it to that individual horse. Do you have anything else that you want to sign off with?
Just that if whether you have or haven't listened to the episode, we talked about conditioning. We talked about that there are foundational exercises that you have, which are proprioception, motor control, balance, symmetry, and having postural function and control. So the ability to move through range of motion or use a group of muscles, and then also to be able to control them well. This comes under the branch of foundational. So when we're talking about motor control and neuromuscular patterning, and this comes before your strength training and your big cardiovascular training. It's wonderful to have those things, but this comes under the foundational branch. We want that before then. But this is how you get that in the future in a way that serves your horse's sustainable movement patterns.
Yeah.
Comfort for life.
And it will make your horse a much more pleasure to ride and work with. And you'll also just learn to recognize those signs of fatigue much quicker. Like, I think we often fatigue our horses without realizing it because they are great compensators. And so if you can check this before, during, on the days off, you will gain a lot of information about your horse's function. And it is an absolute game changer. And do the functional posture course and go into level 2 and you'll get more information. And then there's lots of ways that we can support you through this. So thank you for joining myself, Dr. Raquel Butler, and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights, and reach out with any listener requests for topics you'd like to hear us talk about. And if your business is aligned with our mission, then reach out to become a sponsor of the podcast.
We'll see you in the next exciting episode.